Good morning, everyone. Good morning. Good morning. It's your girl, comedian Joy. I'm joined by the great, wonderful Dr. Mia at Me Bella Wellness. We're here with Weekly Wellness. Oh, these weeks come by so quick, but we're going to have a great show. We're not going to be in here super duper long. So if you have questions, we're going to need you to go ahead and get those in. Today, we're going to be talking about the difference between perimenopause and postmenopause. I'm gonna be forever 21. I don't want to go through any of those pauses over there. And of course, we gotta talk about those hormones. So that's why we have to keep saying our girl and intimacy so we can get it in. Good morning, Dr. Mia. How are you?
Good morning. Good morning. How's everybody doing today?
I am wonderful. I'm trying to make my way back to Birmingham. So yeah, we're gonna do
Oh,
the
yes.
mini
Where are you
version
these
today.
days? Comedian Joy, the
Yeah, I'm in the
traveler.
Caribbean. I'm over here
Oh,
in
in the
Antigua.
Caribbean.
Yeah,
Must
I'm
be
trying to
nice.
hang out like you and Joseph. That's probably key to intimacy. We should talk about one of these weeks. Is to having
Yeah,
these couples trips.
that's right. Couple strips are amazing. So, hey guys, y'all know who I am. I'm Dr. Mia at Me Bella Wellness Center, where we offer gynecology first and foremost to women and adolescents. At Me Bella Wellness Center, the way we offer gynecology is we let you decide your own fate. We give you all the information you need. We give you all the education. We give you holistic and traditional treatment options, and we help you come up with the best treatment plans for you. We allow you to be in control of your health, and we're just there to make sure you make the right decisions because you have the right information. Now, outside of that, since I have so many women with menopause, we also offer hormone pellet therapy, weight management, total wellness with supplements, intimacy solutions, and laser hair removal for not just women, but also for men. So at Me Bella, our goal is to help you live well, age well, and experience everlasting. I'm saying everlasting intimacy.
Until your clock ticks out.
Ticks
And you know
out.
what? You're so good, Dr. Mia, and all the services you offer. I believe there's going to be some people laying in that casket that's still going to be looking good.
Girl, yeah. And lately I've been getting this question about it's a lot of other people in the city doing hormones. Dr. Mia, why your hormones so expensive? Why can't you come down on your price? But what I remind everybody is you don't get everywhere else what you get at Me Bella. Because one, you
Can
get
you
me.
say it again?
That
Yes.
you don't
Let's
get
tell
everywhere
me.
else what you get at Me Bella. It's kind of like Target and Walmart. We're the Target, and some other people may be the Walmart, but it's the Target. We've been doing this forever. Dr. Mia has been doing hormone replacement therapy for 13 years and hormone pellet therapy for over 10 years. And guess what?
What's
We're
that?
the first gynecologists to be trained through BioT for hormone pellet therapy. And so we have a lot to offer. Our pellets are different from other people's. One, because not only do I have that experience, but I feel comfortable going up and I don't just treat numbers, I treat the patient. So if you get the hormone pellet and you're still tired and you still having decreased libido and hot flashes and night sweats, that means you need more. So then I'm going to give you more, and we're going to keep going until we get you feeling the way you need to feel, because we know that maintaining a healthy hormone level prevents heart disease, prevents dementia. Testosterone hormone pellets have shown to decrease the risk of breast cancer and bone loss. So at Me Bella, we take it very seriously, the total wellness component of our practice, and a big component of that is hormone pellet therapy, because all these folks going through menopause and perimenopause, and so they need some help because they want to feel good, they want to look good, and they definitely want to age well. So that is why, and it costs a lot of money to do that. I have a lot of staff that I have to pay, so it does cost a little bit more money to give you the best service and the best hormone pellet therapy and treatments. But I think it's well worth it because our patients are very, very happy and they are living their best lives through hormone balance and total wellness at Me Bella.
I definitely have to agree with you 1,000% because obviously I haven't been to anyone else to get my pellets because I've committed to Me Bella Wellness. I've been following you and with you, doing programs with you forever. Then when I reached my age, I had those symptoms. Then that's when I started getting the pellets. What I love the most is the pellets. You don't even feel it. So when I came there, I think it was last week. I know it's before my trip. We
Mm-hmm.
were just on the table talking, and all of a sudden she was like, "Well, you're done," and I could kind of feel like maybe she was putting a tape on, and I was like, "Wait a minute!" I was, ready to brace myself for a sting or whatever, but that was nothing. So I really love the new way that you all are able to numb you, to put those pellets in, and it's like it's pain free.
Pain free. And how do you feel?
I feel amazing. So, like where I am, I've been climbing hills, I've been in the water,
Uh-huh.
I've been sleeping good. Even with the time change, I feel amazing. And so, I can always tell when it's time for me to get a new pellet because for one of my big things was memory fog and energy. And of course, I'm doing
Mm-hmm.
too much. So when I am kind of can't remember stuff and I'm a little bit dragging, that's when I know. But I look in the calendar because you always make sure that they're pre-scheduled, and then that's when I'm like, dang, I gonna see Dr. Mia in a week, and I get
Yeah,
my pellet in a couple days. I'm good.
that's right. And that's the same with me, comedian Joy. Actually, this time I was like, what's going on? Like, I woke up last night and couldn't go back to sleep. And then I went and looked at my date. I got my last pellet on 11/22, 3 months to the
Oh yeah, it
date.
was time.
I started feeling, but that's the purpose. If I had gotten my pellet, I never would have started noticing these symptoms return. And I think the biggest thing is that we have to remember that when hormones change, that's when a lot of bad things happen in our lives because we're in our late 30s, early 40s. That's when a lot of people are getting divorces. That's when a lot of people are changing jobs. That's when a lot of people are going through their midlife crisis. And a lot of times that's just hormonal imbalance because with perimenopause, the first hormone to deplete is testosterone. So when that starts to decline, that's when women will start noticing, and men, the problems with sleep, the night sweats, the decreased desire for intercourse, the decreased enjoyment of intercourse, the fatigue. I mean, and not just being a little tired, but being completely fatigued where you just don't have the energy to do the things that you really want to do and the things that you need to do. A lot of women also notice that mind fog, like you were talking about, comedian Joy. The mind fog is very frustrating professionally as well as personally because not only does it keep you from being able to remember what you were doing next, but it makes it hard for you to focus. It makes it hard for you to get things done and to accomplish the things that you want to accomplish. So it is actually a big deal, especially when you're talking about job performance and then even with your kids and with your family staying on schedule. And finally, what's really, really important is those people who already suffer with depression, anxiety, they notice that those symptoms get significantly worse as testosterone declines. And also those people will notice you may not have ever had any problem with it before, but now you're more irritable. Everything gets on your nerves. The way your partner puts their cup down now gets on your nerves. You know, the way they walk, the way they talk, the way they look, the way they laugh, everything gets on your nerves and you're irritable. And sometimes you can't even control how you express that, which can be a negative component of all relationships, not just work relationships and not just family relationships, but also friend relationships. So that's perimenopause when that testosterone declines. And once it starts going away, it's not coming back. Some things that you can do to kind of help in between time before you get to that point where you feel like you need help is exercise definitely helps, especially with resistance training, eating a healthy diet, maintaining a healthy weight. But I think the biggest thing that I've noticed is that exercise. Women who exercise more and they do it consistently tend to hold on to their testosterone a little bit longer than women who don't.
So basically, if you are
And
not
men.
into, something strenuous, I know you mentioned regularly about Pilates. That whole strength training. That's better
Yes.
than some massive aerobic workout.
Yes, and it's good when you're on testosterone already, because that muscle mass is so important for your metabolism. So that, indirectly helps with your weight management. And then when you get to that menopause, that's when the estrogen goes away. So a lot of people be feeling good like me. I'm 48. I'm probably going through menopause, but I do birth control, so I don't notice it. But once that estrogen goes away, what women will notice is even if they are being treated, they notice they start gaining weight. Their mood starts to change. They start having the hot flashes during the day. And then they start to notice changes in their hair and their skin. They may notice more hair on their face, less hair on their head. Less hair with the eyebrows and the eyelashes as that estrogen declines. And as that testosterone declines, they also can notice more hair as well as acne on the face. So it affects everything. And for estrogen, also the dryness which negatively
Where's
affects
dry? What are you talking
the
about, dry?
dry vajayjay. Nobody wants dry vajayjay. So
Mm.
with the depletion of your hormones, the vagina starts to dry out, and that's not what we're going for. So that's why I always have my ladies who come to see me to start treating that vaginal tissue in their 40s so that by the time they reach menopause, their tissue is strong, healthy, lubricated, orgasmic, sensitive, and it also decreases the chance of urinary tract infections and urinary symptoms. So it's very important to not only balance those hormones, but also to treat that vaginal tissue like we do our face. We get rid of the wrinkles and we prevent them. Do the same thing with the vaginal tissue.
Okay, well, since you're on the subject, let me just ask you, because Joy gonna ask the question. Are you saying that women should not grease it down if they're, a little ashy down there, or they need to
No.
see you and put a little grease on it?
So
A
not
little
grease
petroleum
necessarily.
jelly.
Now, organic coconut oil works well if you want to do the, clean, make it less dry on the outside. But the real treatment is internal. So using a vaginal estrogen that's prescribed by a doctor, or vaginal DHEA, which is prescribed by a doctor. And sometimes there's some over-the-counter products like hyaluronic acid. And I usually have my patients, if they're not having a lot of symptoms, to just use that twice a week at night, right before bedtime, to put the suppository in. And then if they're having severe symptoms already, I have them to treat the tissue for 2 weeks straight and then go to the twice a week. But it's not just for sexual function. It's also to decrease leakage of urine with coughing, sneezing, jumping, laughing. And it also helps decrease urinary tract infections as well.
So wait a minute. We're talking about action, and then we're talking about peeing on ourselves. Come on, so that's a whole lot. So because I know you got those gadgets in your office, Dr. Mia, but I'm not gonna get too much off track with them gadgets. I just want to come and rent some of them. I don't even know if I'll be using them right, but I'll be using them right enough.
But yeah, so that's a good point though, Comedian Joy, because what I started to notice is that even my ladies, as they were doing their hormone replacement therapy and balancing the hormones, you still need direct treatment on the vaginal tissue. So that's why we do the O shot for women along with the O wave. Those things are going to increase the blood flow to the tissue and help regenerate tissue so that you have a more sensitive, lubricated, orgasmic, tightened vaginal area. And it really makes a difference. Most women are going to get that done every 1 to 2 years to maintain good intimacy and regular, significant big O's.
So let me ask this thing, because I know you also treat the men. If you're treating the woman and she's ready to be like, but then, does he need to be treated too so everybody can,
Right. And so, yes, so we take care of men. And that's how we got into taking care of men. We would get our ladies all fixed up. They were feeling good. They were looking good. They were losing the weight and happy. And then they realized that their husband is also aging. And so they go through what we call andropause, which means that their testosterone levels decline. And when their testosterone levels decline, they get some of the same symptoms, including a decrease in drive. And just like our girl parts change and we start noticing more dryness and laxity and decreased sensitivity, the same thing happens for men. They have what we call erectile dissatisfaction, so they can't maintain an erection like they used to. The erections aren't as hard and as firm. They feel like they notice shrinkage, and that can be treated as well with the P shot and with P waves. And we also do hyalogel, which is a asset on top of doing the O shot or the P shot that just further enhances the results so that everybody can have everlasting intimacy and enjoy it the entire time, even while we age. And then, a huge component of all of this is the total wellness component. That's why our focus at Me Bella Wellness Center is total wellness. You can't feel good and have great intimacy without that total wellness, making sure you're doing your prevention and your screenings and protecting your heart and keeping your blood pressure low, keeping your blood sugars low, keeping your cholesterol, all of those numbers in order so that you can have good blood flow and maintain great intimacy. It all works together.
So you're going to have folks in their house acting like Tarzan. Whoa.
Right. We're going to have some happy households, some happy marriages, some happy relationships, and some happy people. Because, women and men who have regular intercourse and continue to have big O's, they live longer than women and men who don't. It's good for the heart. It's good for just the mental capacity, and it's good for total wellness. So you need to have great intimacy with a partner or without.
You heard that, with or without. That's what Dr. Mia said. I prefer to have a partner,
Right. But if you don't, and even sometimes, it's healthy. It's all healthy. God gave us a body that we can use with a partner and enjoy, or enjoy without a partner. Thank you, God.
That's right. And just don't be ashy down there when you with your partner, because she can help you get greased up.
Just use
because if you're ashy, it can crack something.
And a lot of people don't like the idea of the inserts, Comedian Joy, because they remember the creams that were messy and irritating, and it's gross when you wake up and you're sleeping through the night and you're feeling all this cream come out. No, we don't use those old-fashioned creams anymore. We use suppositories. So there's some new prescriptions out there and non-prescription options that aren't messy, that are going to give you a better result than using some of those old-fashioned estrogen creams. We use a natural estrogen cream, a natural DHEA, and a natural hyaluronic acid. You can use one, or you can switch between them, or you can use, two at the same time. It all depends on what your goals are for your body and your sexual function.
So what if you wake up in the middle of the night? Is that going to be too messy, or you just get the towel and don't worry about it?
No, you don't even notice it. You just go to the bathroom like normal, wipe, and you're done. You know what I mean? It's not that messiness. It's not like you have to wear a panty liner because it's going to mess up things. So most women do not have a problem with the newer suppositories that we prescribe at Me Bella Wellness Center.
Gotcha. Well, that is awesome. So if you all have questions, we need you to go ahead and put them in the chat, because we're going to be ending in about 3 minutes. This has been so informative. We talked about why you need to get the pellets, because I got my fresh pellet. I am so excited. That's why I'm pumped. We talked about being ashy down in the basement. Y'all don't want that. That's just not a blessing at all.
No driver JJ. We don't want it.
Exactly. And we also got treatment for your partner, the man, the special man in your life. So both of you all can get it together and all be happy and all of that good stuff. So if they have more questions, they can always follow you on your Me Bella Wellness page on social media, and they can also make their
make sure they join the community page, which is Ageless Bells and Bows with Dr. Mia and Joseph. That's where we're going to start doing a lot more lives and give you a lot more information, because it's more of a private group and a community. And we want to build the community for those women and men, those ageless bells and bows who truly want to live well, age well, and experience everlasting intimacy, because we're all going to age, but we can age gracefully, and we can age and be healthy and still experience total wellness as well as great intimacy. So if y'all need to schedule your appointment, you need to make an appointment for your consult. Remember, you do not have to live in misery. There are options. Some of those options do require an investment, but the value that you get from these options, I can't even communicate and put into words. But we also have other options for those people who may not be able to afford to get the pellet. We also have the other option of the cream. So I do have patients that do creams. My patients who do pellets seem to be happy. And I have plenty of patients who do the creams, and they're still happy as well. It just requires consistency and a little bit more work by you. But you don't have to live in misery. You can grow. You can mature and age well, and live well, age well, and experience everlasting intimacy. So we're going to let Comedian Joy, get to her stuff. But Comedian Joy, go on and give us a little rundown of what's going on with Eat, Drink, and Ride, and all your travel and all the other thousands of things that you do in our community.
Yes, so I'm still doing food tours. That's when we go to 5 local restaurants in 4 hours. We have small bites and some adult beverages. I have a wine tour out there. And guess what? For those who've been saying, when are you going to Uncle Nearest Distillery? We're going on March the 9th. March the 9th. So it's a date. Yes.
What day of the week is that?
It's a Saturday on March 9th.
That's awesome.
Yes, we're going to leave, I think, at 7:30. So it includes breakfast, mimosas, and your tour ticket to get in. It is $175. And you also get the tastings of the liquor. So it's going to be a great trip. So you need to go there and book it. If you're looking to travel, you can also look me up for that as well. And because I am a travel agent also, so that's how I'm expanding the company. And if you need transportation, of course, prom season is coming.
Prom, Marley going to the prom.
I know I got to get Marley on the bus, because I got to make sure she's safe and them boys don't be trying to, push up on my girl.
Mm-hmm. Right.
Yes. So if you looking for some fun entertainment trips, travel, then look me up. I'm your fun person, and I'm all perky and fun because I get that pellet from Me Bella Wellness.
Thank y'all for joining. We'll see. Me and Joseph will see y'all tomorrow. Ageless Intimacy with Dr. Mia and Joseph. We will see you on tomorrow. So I don't even remember what we're talking about, but it's going to be good. You don't want to miss it. See y'all later. Thank you, Comedian Joy.
Bye.
Safe travels. Get back here, honey, because I'm going to need you again.
Yes, ma'am. See you soon.
Bye. Y'all have a great